thank you all very much for coming to the return of our series, formerly known as Falls Prevention, Stress Management for the Aging Adult, rebranded for the fall as Aging Strong, Falls Prevention. And now I'm going to introduce our program presenter for today, Debbie Lynn Toomey. She is a Tufts medical coordinator. She has been running this program for us all of last year during COVID. We took a brief summer break and we are now back ready with a fresh start. So Debbie, thank you so much for joining us.
Thank you so much, Carrie, and thank you to the Quincy Public Library for continuing to support the work of falls prevention. So as Carrie mentioned, my name is Debbie Lynn Toomey, and I am the Injury Prevention Coordinator for Tufts Medical Center. And this is going to be the beginning of our series for the year 2020, 2021 to 2022. So tune in every month because we will have this program live stream to YouTube, Facebook, and also the recordings you'll see on the QA TV. So every month on the the second Tuesday and the fourth Tuesday of every month from 10 to 11, I will have a different guest speaker. And all the guest speakers that I'll be inviting on the program are the ones that's going to really hopefully enrich our lives as aging adults to help us be able to know what resources there are out there, anything that's new and also pertinent that's going to help us live a good quality, healthy, and happy life. So today I have a colleague and she's become a good friend. She is my counterpart at Beth Israel Deaconess Medical Center. And because it is fall and Falls Prevention Awareness Day is around the corner, which is the first day of fall, we decided to dedicate the first program of September to be on falls prevention. So Katie Kowalski, welcome. Thank you for being here.
Thank you so much for having me, and thank you to the Quincy Public Library Services for offering this amazing program. I'm really excited to be back.
Awesome. So the program that we'll be sharing with you all today it was born out of a collaboration between Tufts Medical Center, Beth Israel, and Brigham Young Women. And we've been doing this since 2019, correct?
Yeah.
So we were doing it in person originally. And then when COVID hit, we turned it quickly to remote because we knew how important it is to continue to get the word out there on how to prevent falls and different ways that people can really live in a very safe environment and also be able to continue doing their activities. So without further ado, Katie, can you start our slide presentation and we'll be able to go on?
So this is our collaborative presentation. Again, we've started this 2 years ago, presented today by Debbie and myself. Just a little disclaimer. I am a social worker. I am not a medical professional, and Debbie is a registered nurse. So we are not giving formal medical advice at all. We are only providing education on falls prevention and information on other educational programs that aim to reduce the risks of falls. So please consult your primary care physician prior to making any changes that you might see in this program today. So what is a fall? A fall is defined as an event which results in a person coming to rest inadvertently on the ground floor or lower level. You do not have to land on the ground for it to be considered a fall. And this is something that a lot of people misunderstand, right? So sometimes if you're in your kitchen and maybe you trip and you catch yourself very suddenly on the counter, you might think because you didn't fall on the floor that you didn't have a fall. But according to this definition, you did. Because you came to rest inadvertently, you weren't intending to, and you ended up lower than you started. And that's a definition by the World Health Organization.
So here are some facts about falls. 1 in 4 older adults age 65 and up falls every year. And it's very costly to the consumer, the person getting hurt, getting injured, and also costly for the insurance company. Luckily, it is preventable. And organizations like the CDC have created a program called STEADY, and they created this way for healthcare professionals to really be able to get the training and have resources, presentations, and different exercise suggestions that they could use to teach the people age 65 and up. So the dangers of falls, as I mentioned, 1 in 4 senior fall every year. And unfortunately, 1 out of 5 falls causes a serious, very serious injury. And if you kind of think about the time, the clock, every 11 seconds, an older adult is treated in the emergency room because of a fall. And once somebody falls, they're more likely to fall again. It doubles the chance of falling again. So each year, about 3 million older adults are treated in the emergency department for fall injuries.
Here you can see on this chart, it's a little hard to read, but this is coming from the Whiskers database, and these are the 5 leading causes of emergency department visits in the United States. This is as of 2019. That's the latest data that they have. And you can see here the red boxes and the blue box at the end there. Those are all unintentional falls. So falls are the most common injury that are being treated in the emergency department for age groups 25 to 65 and up. And it's the highest ranked injury affecting all ages.
And just to just kind of reiterate, when we talk about unintentional falls, these are basically falls that's not planned. I mean, what falls are planned? Unless you're an athlete and you intend to do a fall. So unintentional falls are just things that it makes you lose your balance and you kind of fall to the ground or a lower surface. So there are risks for falls. Poor balance, polypharmacy, lack of sleep, alcohol use, footwear, foot pain, vision, hearing loss, home hazards, and depression. So the consequences, go ahead, Katie.
So as far as some of the consequences, the long-term consequences could be decreased independence in daily living skills, an increased risk of nursing home placement, and really high healthcare costs. Some common fall injuries are soft tissue trauma. So that could be cuts, scrapes, bruising. Head injuries are a big one. Same with hip fractures.
So the big question is, can most falls be prevented? The answer is yes. So how can they be prevented? Well, we have to, first of all, eliminate the factors that lead to the falls. Finding the root causes, right? And also becoming more active. And also using assistive device when needed, attending regular visits with your primary care doctor, reducing your stress, and keeping up with your medications.
So first up, we're going to talk a little bit about home safety. So the first step would be our steps or stairs. So really always trying to make sure that you keep those stairs clean, keep objects off of them, books, shoes, clothes. It's very easy to walk in your door and just kind of toss a jacket on your steps, but really try to hang it up or get it out of the way. If any of them are loose or uneven, make sure that you get someone to fix that, whether it's a building manager or an outside contractor. Having lights at both the top and the bottom landings of your stairs is very important. That way you are able to see the stairs in no matter what direction you're going in. If you have carpets or little strips of carpet, make sure that those are fixated, glued down, nailed down, and they're not coming up, they're not curling, they're not becoming tripping hazards. You can also use rubber treads. Having handrails on both sides that go all the way up is also going to help you with some added stability. If you already have handrails, make sure that they're sturdy. So fix any loose handrails. And consider getting a stair lift or installing ramps if you're able to. So here you can see some of those examples that I talked about. In this left-hand corner, this is what a stair lift looks like. The bottom left-hand corner, this woman is wearing a very, very long skirt. And so the clothing that we wear when we go up and down the stairs is also very important. It looks like she's about to trip on the skirt. In the middle, in the top right here, you have examples of lights. If you are unable to install light switches on the top and bottom, these just stick onto your wall and they are motion activated and battery powered. They're available at like your local hardware store or Amazon, anything like that. And then of course, the bottom right, look at all that clutter on those stairs. That's a huge tripping hazard. In our living room area, it's the same idea. You want to pick up clutter, especially wires, which you can see here in the middle. Wires are a big tripping hazard, especially now. We have a ton of electronic devices in our homes. So really try to get those out of the way and along the edges of your room. Same thing with our furniture. So if we use an assistive device, you need to make sure that you have a clear path in your room to be able to navigate with that device. Remove or fixate rugs to the floor. So your area rugs, carpeting, that sort of thing. Make sure, ideally, you would get rid of those. But if you really are attached to them, there's special sticky tape that you can get to make sure that the corners stay down and things like that. But you really want to make sure that those aren't moving, that they're non-slip, and that they are not curling up. And of course, like I mentioned, beware of cords. In your kitchen, it's recommended that everything stays about waist height for you. So you're not having to get up on a step stool or having to bend down to get things. So any of the things that you use in your kitchen the most often, try to keep those waist height. Step stools, if you do need it, they do have these really nice step stools with a little grab bar. So it offers a little bit more support and it has the 4 legs. So it's very sturdy. And you can see the black here is a non-slip surface. And of course, be careful with water on your floor. It's very easy when we're doing the dishes or unloading the dishwasher, or if we have pets in their water bowls, it's very, very easy for water to get on our floors. We just have to be very vigilant about cleaning up those spills. In our bedroom, we need accessible lighting, and that means accessible from your bed. So if you are able to have a lamp on your bedside table, that's a great idea. Having a clear path from your bedroom to your bathroom. Beware of blankets. So some people are restless sleepers. They kick their blankets off in the middle of the night. And if you need to use the restroom in the middle of the night, you're prone to trip over it. So making sure that you take that extra second and turn on your light to look at your surroundings is going to be really helpful so you can avoid tripping over blankets or pets. Here you have some accessibility tools for the bedroom. You've got these handrails that just go under your mattress. This in the middle is a bed light that you just are able to plug into the wall and keep it under your bed. It's motion activated. And of course, the clapper, if you don't have a lamp by your bedside table, if you don't have a bedside table, or if there's really no other way that you can get to your light, you can simply just clap your hands and turn on the lights that way. In our bathrooms, of course, water is on the floor, whether we're bathing or washing our hands. So make sure that you have a non-slip bathroom floor mat that's going to help absorb the water outside of your tub or shower. Inside your tub or shower, have grab bars installed. Those are the ones that will screw into the wall. We don't want to use the suction cup ones because they're not going to be strong enough to catch you if you were to slip. And if you need it and you're unable to stand, or maybe you feel weak, consider getting a shower chair. Here are some more accessibility tools. You've got a little grab bar here on the bathroom ledge. And this is a different kind of shower chair where it attaches to the ledge of your bathtub, and it actually helps you to get in and out of the tub. You sit on it on the outside, and then the chair itself swivels, so you are then able to stand up inside the bathtub. Here you have an elevated commode, which can make it easier to get on and off of the toilet. And you've got little grab bars here to help you be able to push up off the toilet. Here are some additional accessibility tools. So we talked a little bit about why it's important to wear safe clothing when we go up and down the stairs. For those who like to wear flip-flops or slippers around the house, consider wearing these instead on the left-hand side here. These are great Velcro closed slippers. They are non-slip and they have backs to them. We don't want to see anyone in flip-flops or those kind of shoes. If you need help, you can get a very long shoehorn here to help slip your heel in. But these pink slippers totally come apart and they're very easy to put on and off. On the bottom left and the middle right here, these are things that you attach to your doorknob or your light switch, and it just makes those things easier to grab. Down here in the bottom right, you've got a little mini ramp that you can have inside of your house for doorways. So if there's a little bit of a lip from one room to another, you can use that, and you're less likely to trip on it because it's a gradual elevation. And if slippers are not your thing and you like to wear socks around the house, please consider getting these non-slip socks that'll give you a little bit more traction. And if there's anything that you have trouble reaching but don't feel comfortable getting on a step stool for, please consider getting one of these little grabby devices as long as the item is not too heavy. Finally, the emergency response system is very, very important. So some people have Life Alert, Lifeline. Any of those companies are great. They come with a necklace or a bracelet that you can wear, and you just press the button if you need help. So once you do that, Life Alert or whatever company you use, I will ask if you need emergency help. If you say yes, they will send the proper people to your address. Now, with smart home devices, Amazon Echo, Google Home, it connects through your Wi-Fi and you can sync it with your phone contacts. So instead of having to push a button or anything like that, if you have one of these devices in your living room or your bedroom, you can say, and you've fallen, you can just say to the device, Alexa, call George if George is your son. These will not call emergency services for you, so they will not call 911, but they can get you in contact with someone who can. The other thing that's great is sometimes you are able to connect your lights to these as well. So in the bedroom, if you need to get up in the middle of the night, you can just say, Alexa, bedroom lights on, and she'll turn on the lights for you. If you live in an assisted living facility, check your emergency response system in the building. Ask the building manager or your residency director, what is the emergency protocol if you were to fall? How do you alert the staff? How do they get you help? And so these are just really good things to have in mind.
Thank you. So let's talk about medications. It's very important to make sure that when you are taking a medication, that you know what it's for and what are the side effects and also the best time to take them. And also it's good to know why you're taking them, because some people may just start taking a medication without asking their doctor, why am I taking this, or how long should I take it? So the more you know about your medication, the better. So knowing who prescribed it is also very, very important, because some people might have a cardiologist or a kidney doctor or an eye doctor. So all of these doctors, they may be from the same organization or may not be, but it's always good to know who's prescribing the medications, and also making sure that your primary care doctor, the doctor that's really in charge of your overall health, to know all the medications that you're taking. As far as medication disposal, it's very important to know how to properly dispose of them. So it's no longer acceptable to toss all of our medications in the toilet. There are some that's okay to toss in the toilet, but that's something you have to go to the FDA, and there's a link that will tell you which medications are okay to flush in the toilet. Okay, and then also if you're not sure, looking to see if there's any type of drug take-back programs that's near you where you can just bring all those medications. That's really, really, really important, especially if you are taking any type of narcotics or opioids. As far as medications go as well, making sure that you don't remember the medications based on just the actual pharmaceutical name, because as we all know, medications also have generic names. And so these names can look so different from the actual, maybe the brand name. So knowing both is also good. And also not relying on the shape and the color of the medication to remember them by, because different pharmaceutical companies may cut them, color them, the same medication differently. And so, it might confuse you. So always knowing what medications you're taking, why you're taking them, who prescribed them to you. And also when you're getting your medications from the pharmacy, always make sure that you know exactly what you're supposed to be taking, because the pharmacist will ask you if you have any questions. So always ask your questions. All right, next slide. So here is a program or a nice campaign that's called Up and Away. It's a great reminder for us to really think about the medications and how other people that could be going into our home, maybe young children, other adults, or people that we live with, how they might accidentally take the medications by accident. So in this beautiful slide here with the images, if you could imagine 4 busloads of children. According to the Alliance of Aging Research, about 4 busloads of children per day visit the emergency room because of medication poisoning. And that's about 1 every 8 minutes. That's pretty scary. And so making sure that your medication is up and away is very important. So always put all your medications, even supplements, in the same location. And hopefully they are far enough away from the reach of young children, but not too far that you have to use step stools or a ladder to get to. Just making sure that they are, if it's out of sight, out of mind, okay? So 86% of ER visits, according to this infograph, the child had easy access to the medications. So children most commonly find the medications on counters, nightstands, dressers, purses, bags, or even on the ground. So if you happen to drop any of your medications, try to look for that medication. So that way, if you have a pet or a young child, that they don't accidentally pick them up thinking that they might be something that is digestible or ingestible. And on the bottom right is the electrical outlets. It has nothing to do with medications, but also that's a safety concern to make sure that nobody gets electrocuted. So bottom line is keeping the medications out of sight, out of mind, up and away. And looking at the statistics here on the right, it says more than 5 children are being raised by grandparents these days. And 1 in 8 grandparents they see their grandchildren regularly. And it's becoming more and more common to have a multi-generational household. It's becoming a national trend. So very, very important, once again, to make sure the medications are up and away from the reach of other children. So balance and exercise. These are also factors that can help us from falling. So keeping our body strong, doing activities that's going to enhance our balance, our strength, our flexibility, endurance, very, very important because they have been shown to reduce falls. So a regular participation in physical activities is very important to the maintenance of good health and functional independence in older adults. So they describe here balance and strength training can reduce fall rates and neuromuscular fall risk factors. So that basically just states that not only are balance exercises good, and we don't expect everybody to look like this woman because I don't know if I can do that myself. But strength training exercises are important because once we reach the age of about 40 and up, our muscle mass starts going down. I'm not sure if you remembered in one of the beginning slides, one of the risk for falls is sarcopenia. And that's basically when our muscle mass starts decreasing as we get older. So even more important to really exercise the muscles as we get older. So that way we can sustain and regain some sort of strength to our body. So the suggested activity from the CDC for aging adults. So basically when I do a program, I like to have the participants think about their normal routine. And once they kind of have an understanding of what they normally do, then that's when we can say, please, whatever you're doing, add extra time for other activities. And that would be, according to the CDC, 2.5 hours of moderate intensity aerobic activity every week. So that's not every day. So just a total of 2.5 hours of extra aerobic activities every week. And you can break it down to 15-minute segments during the day or half-hour segments, just so that you can really move and be active. They're also recommending, once again, muscle strengthening activities. So that way, once again, we are really keeping the integrity of our strength and our muscles. So here are some really active people on the slide. There are different types of exercises that's recommended. So balance exercise, which helps with our stability and coordination and reaction time. Very important, especially if we trip. Our reaction time is very, very important to help us really brace ourselves. Flexibility. These are exercises that help loosen the joints and muscles, decrease achiness, and enhance our movements. So we have Go for Life there, because that's a great website to check out, because they have so many different exercise suggestions that really touches upon the balance, flexibility, strength, and endurance. So going across the screen here, strength exercise, those are exercises that helps you with grip. It could be gripping with your hand, using a tennis ball, or even using towels to use your toes to grip. Those are very good. Strength exercises help with metabolism and also keeping the sarcopenia at bay. And lastly, endurance and cardiovascular. So that has to do with really exercising our heart, the pump of our heart, and also our lungs. Because, even though some people may be taking medications for the cholesterol or high blood pressure, or maybe they might have a history of heart attack, it's still very important, because these organs, the heart and the lungs, they're muscles. And if we don't exercise them by using endurance or cardio exercise, then our ability to move around and have that energy will lessen. So very important for vitality and energy, circulation, and stamina.
And now we're going to talk about some of the programs that Debbie and I offer. The first one here is A Matter of Balance. It started at the Roybal Center for Enhancement of Late Life Functioning at Boston University. And it's designed to reduce the fear of falling while increasing activity levels of older adults who have concerns about falls. So it is a lot of group discussion and problem solving. You'll learn some skill building as well as assertiveness training. You'll also be able to share practical solutions to everyday problems. You'll watch a couple videos as well as an exercise component. So it is 8 2-hour sessions. So that's 16 hours in total. You'll learn to view falls and fear of falling as controllable, setting realistic goals for increasing your activity, how to change your environment to reduce fall risk factors, and promote exercise to increase strength and balance. Word about Matter of Balance, it is being offered virtually. I unfortunately do not offer it virtually, but I can get you in contact with someone who does.
Katie, I just want to add something about Matter of Balance. I'm not a Matter of Balance trainer, but I did when I first started this my position at Tufts. I did sign my parents up at the local Y when they were offering Matter of Balance, and I also signed myself up just to understand what the program's about, and also as a caregiver for my parents. It was very important for me to know how I can support them best. So I encourage people, if you have aging parents, if you have time, to also sign yourself up for the same class. So that way you have a common understanding and also language to, discuss different ways to reduce any types of falls. And the Tai Chi, both Katie and I offer the Tai Chi Guan, moving for better balance. And there are so many different types of Tai Chi forms out there that has been proven to help reduce falls. But in a nutshell, Tai Chi is a very slow moving meditative exercise that began in ancient China about 500 years ago. And it combines a stress reduction with movement to improve health. Okay, so here's the logo for the Tai Chi Guan, Moving for Better Balance. And again, it's research proven, evidence based. It helps with balance and also fall prevention. It offers different types of features. It helps with movement. So it has movement therapy, sensory motor challenge, and cognitive functions. It uses 8 basic forms. And also there's built-in exercise variations, subroutines. It's integrated. It's just full of integrated therapeutic movements, and it's really, really great. It does take a while to complete the program. It's a 6-month commitment, right? And so it's 1 hour long, twice a week for 26 weeks. But the good thing is every time you're taking a class, you're cultivating a sense of balance, strength, coordination, and flexibility. And it does help with cognitive function, it helps with memory, and also just different ways to help you kind of think and remember. And this can be done virtually.
Another thing to note, the difference between a Matter of Balance and Tai Chi Chuan is that Matter of Balance is primarily a discussion-based program. So you're going to be doing a lot of talking, and there's just a small component of exercise, whereas the program that Debbie is just talking about is just exercise. There's no discussion component to it. The next one is Think First to Prevent Falls. This is a program that I offer. It's actually a program that I did for this program back in February. It is sponsored by the National Injury Prevention Foundation, Think First. And so we talk about all kinds of really neat things, such as like the brain and pretty much the science of falls. We'll talk about nutrition, exercise, vision, medications, a lot of what we talked about today, but we'll go more in depth. We also talk about things like community safety and talking with your physician. It's about 1 or 2 hours. I can also offer it virtually or in person.
So for those of you, as Katie mentioned, she was my guest speaker back in February. And if you missed that program, you can go back to the QATV listing or the library listing to watch what she had to share, because that was a really great program. So I want to thank you for doing that, Katie. Aging Strong, Strengthening the Body and the Mind is a program I created for Tufts Medical Center. It's an evidence-informed program. So it's just pulling from different types of research-proven facts and also research on how to prevent falls. And it's an hour and a half long, and I offer it for 4 sessions. So each session basically builds upon each other. And before the COVID pandemic, I was offering it to local senior centers, Council of Aging, then independent living and assisted living. But since then, I wasn't able to because of course, the pandemic. And that's why we have this program. We had to turn Aging Strong in a way into a program that is slightly different, but allows me to interview and have other people on the program to teach us and educate us on how to prevent falls and live a quality life. So there's great things that do happen during difficult times, right? So next slide. This is the program that I was just talking about. And great news, other communities out there in the Commonwealth of Massachusetts have been downloading the program, and they've been benefiting from the wisdom and the information that all the guest speakers have been sharing. So it's a win-win for everybody. So I invite you to continue watching the program. Again, it's offered the 2nd and 4th Tuesday of every month from 10 a.m. to 11 a.m. And another program I created for Tufts Medical Center, because I love mindfulness and I do a lot of mindfulness workshops. And I figured, why not offer a mindfulness for healthy aging program? So this is an in-person or a remote program, and it's 3 sessions long. And I introduce the topics of mindfulness and also different exercises that people can do to help reduce their stress and also help them feel more calm and centered and less distracted.
And of course, so again, we have to reiterate, do not start any of these exercise programs without consulting your primary care physician. At least for Matter of Balance and Tai Chi Chuan, we actually require a sign off from your doctor that says, yes, you are okay to participate. But if you are unable to go to any of these programs that we offer, there are other resources that you can find on your own. So one is Go for Life. We had mentioned that earlier. It is brought to you by the National Institute on Aging. So it's Go, the number 4, and then Life. Steady from the Centers for Disease Control and Prevention, which is mainly a clinician-based program, but your primary care physician might be using the Steady toolset. And Staying Strong, which is also from the CDC. It is a newer program, also very clinician-focused, and it's to expand the screening of falls as well as the risk factors. So getting those patients who are really at a high risk for falling, making sure that they're identified, and then you start to work with your primary care about how to make a plan, right, to reduce your risk of falling. Finally, here is our contact information if you are interested in any of the programs that we mentioned earlier.
Thank you so much, Katie. So since we had to convert this particular program from in-person to remote, what do you think has been the wins for us as far as being able to continue the work and promote topics on falls prevention?
Oh, well, I think that, for sure we've been able to continue the work, which is a huge benefit. And I think that, we've even been able to increase our reach, which is something that, before the pandemic, Debbie, it was really difficult because, you had to factor in travel time, and not all of us had vehicles at the time. And it was just logistically kind of tricky. So with having to convert to virtual, not only are we able to offer more programs, like we're doing this program again later today, but we're also able to reach communities that were further out than we thought we would be able to. So it's been a challenge, but it's been good.
Yeah, I just found being able to convert this program remotely to be very efficient and very effective. And like you said, we've been able to go beyond our caption. Later on today, we'll be going in Sudbury remotely. So is there any other, if we were to revamp this program, or if you think there's something missing, is there anything that you think we might want to add? Because as you know, we're constantly trying to improve upon our program, right?
Absolutely. I think one thing that might come to mind is just maybe a separate workshop that we can do together about emergency preparedness in general for older adults. With all of the tropical storms, and we had a hurricane not too long ago, it's really, really important that our older adults are prepared, because those tend to be, the more vulnerable populations. They have higher needs. And so to have those plans in place, you hope you never need them, but in case you do, I think would be really important.
That's so timely that you said that. Because I signed up for a CERT program, a community emergency response training program, and it's starting tomorrow. I was able to get in because there was a long waiting list in Quincy. And so I was able to get in, and I was thinking to myself as I was reading the different types of preparation for the program, how can we have some sort of a CERT specifically that addresses and also helps the aging adults? Wouldn't that be great, huh?
Yeah, absolutely.
Yeah. Oh my gosh, it's so timely. All right. So we do have another guest. Her name is Melissa Donegan. And let me just see here. Let me put on the gallery, and I'm going to spotlight you, Melissa. Welcome, Melissa.
Hi, Debbie. Thank you.
Thank you. Okay. So I think you are you spotlighted? I think you are, right? Yeah. Yeah. Go ahead. You're here. And Melissa Donegan, by the way, is from not the Quincy area. She is up in the North Shore. She works for the Elder Services of Merrimack Valley, which, by the way, is a beautiful area. I've taken classes there before in that region. It's such a beautiful area. So welcome, Melissa. What do you have to share with us today?
Thank you, Debbie. Yeah, so in addition to working up here in the Merrimack Valley in the North Shore area, I am the Assistant Director of the Healthy Living Center of Excellence, which is a statewide sort of hub for all things evidence-based programming. So I heard Katie talking a little bit when I logged in, and of course, Debbie is aware of many of the evidence-based programs. Sounds like they discussed those with you. And so some of those evidence-based programs that we help disseminate and oversee in the state are falls prevention. So we do a lot of work around education and programming around falls prevention. And every year, the National Council on Aging, or NCOA, helps host across the country something called Falls Prevention Awareness Week. It used to just be a day, and last year they switched it to really celebrating and highlighting falls prevention for a full week. This is actually the 14th year that they've done it. And every year there's a different theme around different partnerships in the community and really supporting older adults in, communicating with their doctor and really taking charge of their own health and their own falls risk.
I'm always so impressed with what your organization has to offer. I know I have brought, because of the different types of evidence-based program that you all offer, I was able to partner with you all and also Sarah Tan, and was able to bring the chronic pain management to the Quincy senior elders at Kennedy Center here. And that was really good. So I really appreciate all the different programs that you all make so available to people. All we need is just the connection to be able to bring that program here and the trainers.
All of the programs that are happening, because so many are happening remote, like you're saying, you're doing one in Sudbury today, but you don't even have to be there. Pretty much 99% of the workshops going on in Massachusetts right now are being held remote. So it is nice. It doesn't matter where you are. You're able to join a program. I know that was something that, before COVID and when things were all in person, of course, it's great getting to see people and getting out of the house. But if there wasn't a specific program in your area, you had to then wait for one to get scheduled. And now if you log on and there's a certain class happening, but it's in the Berkshires, and you're in Boston, it doesn't matter because you're zooming in and you're able to take part in that class no matter where you live. So I agree. The pandemic has definitely been, stressful and hard, but it has definitely presented us with some unique ways of doing our work and really reaching a broader audience. So, yeah.
That's
so
great.
Website, and I'll put our website in the chat as well right now.
Okay.
And that is statewide. And people can we have a statewide number. So people they can contact us. We have a couple different ways on our website to contact us. There's like a referral form that can be for older adults themselves, caregivers, or professionals to make referrals. We have a number you can call, and one of us will get back to you and discuss where you live and what programs you're interested in and help connect you back to your community. Just because it can be confusing sometimes, who do I call? But it's sort of all in one place there on the website. So
Can you share with us the different programs that the Healthy Living Center offers? Because I know it's not just solely on falls prevention. There's other ones too. It's very, everybody, I invite you all to really check out this website because there's so many different trainings that lay people can take and become trainers. So you could be the champion for your particular group and be able to start promoting wellness and also fall prevention. So.
Yes, we love that. We love when a participant enjoys the program so much that they then want to get trained. So we sort of look in the state, we run over 20 evidence-based programs. So we sort of look at things in buckets. So of course, falls prevention is one. So a matter of balance, of course, Tai Chi Chuan, moving for better balance. And then there are so many varieties of Tai Chi. So Brookline Tai Chi is done, a couple of other ones as well. We also have a program called Enhanced Fitness that is a physical activity program as well. That is run, we contract that workout with the YMCAs. But of course, we can post those or link people up with, there's many YMCAs all across the state doing enhanced fitness. And then we sort of have what we call our chronic disease bucket of programs. So we have chronic disease self-management, diabetes self-management, chronic pain. There are 2 culturally appropriate versions in Spanish, but the programs here are really run in a variety of languages. So we have Chinese, Vietnamese, Portuguese, Spanish, and English, of course. So lots of those. There's also a program called Walk with Ease, which is now, there used to be a group version, but right now that is sort of being done self-directed. But we have physical therapy students at Springfield College who are doing weekly phone calls with the participants. So you get a book, and it's really about arthritis. So the book is really great with some educational materials and sort of a walking schedule, and you just self-manage yourself through that. And you get a call from a PT student, which is really great. We also have a new program we're rolling out here called Home Meds, and our nurses are going to be doing that. And that's a medication reconciliation program. There's a lot of polypharmacy with older adults. So that program, we do kind of look at the medications, they get put in a database, and we have some pharmacists at the Mass College of Pharmacy who are also trained in the program. So they're able to go in and see if there are any alerts, any red flags that come up, and then they can follow up with the older adult and review those things with them. And then we also offer a variety of caregiver programs. So we have Powerful Tools for Caregivers, which is run in the state. That's more of a general caregiving sort of class. That can even be for grandparents raising grandchildren. It can be for, parents who are raising maybe disabled adult children, or it can be for children, caregiving for their loved one or an older adult parent, aunt, whatever. We also have Savvy Caregiver, which is a program specifically for caregivers working with a care recipient who has Alzheimer's or a related dementia. So it's more of a training for the caregiver. Think about, you get diagnosed, you're sitting in the doctor and you get diagnosed with something. And this isn't, a bash on doctors, but they are very limited in their time, and there's not a lot of education given. And the same really goes when your loved one or care recipient is diagnosed with Alzheimer's or related dementia. There's really no information or education given to the caregivers. It's really on them to Google or find resources. So this program is wonderful. It's most of these programs are 6 weeks long. They meet once a week for 2.5 hours. The Matter of Balance is 8 weeks. Of course, Tai Chi goes on longer than that. But it's really nice because all of these caregivers are really going through the same thing with, memory loss and the behavioral things that can, happen when someone has that diagnosis. And we also have a new online e-learning platform for caregivers called TrueAlta. So we have slots. People can reach out to the Healthy Living Center. We send you a link to register. And this is a general caregiving tool as well. But you can kind of choose different areas that you're interested in, self-care or, advanced planning, things like that. And it will give you little courses to watch, articles to read. It's just such a fabulous tool. So that's something else that we have paid already ahead of time for some slots that we're able to send out to caregivers. Another bucket is nutrition. So we have a healthy eating program, Healthy Eating for Successful Living, which is a 6-week program, really learning about making healthy choices, and it's all in moderation. So, you don't come eating cake and leave eating only kale. It's really all about balance and learning how to read food labels, how to really kind of, get your fats, proteins, and carbs throughout the day. Just learning more about that. And then behavioral health. So we have a one-on-one program that works with older adults on symptoms of depression and social isolation, and we can help work through them and set some goals. And then we have another program for substance use disorder. That's the same thing, and it can help older adults and adults with disabilities who are at risk of substance use disorder, might have some risky substance use going on, and we can kind of help work through that. All of the programs, no matter if they're one-on-one, if they're in person, if they're being held remote, they're all offered at no cost. to anyone in the state 18 and over. So we can take referrals for any of those. And they're fabulous programs. Really meant to, just really support self-management and, advocating for yourself and just really taking charge of your health and learning, what are the red flags and what are ways that I can better manage, what's going on in my life. We even have spouses. So, oftentimes if it's a diabetes workshop, if maybe the wife is diabetic, the husband will join her, which is awesome. Because so he can, they can really help support one another.
Wow. Well,
I might have left a program or two out. I don't know. We have a lot, but it's all on our website.
Definitely, I encourage everybody to check out the website because as you could hear from Melissa, it's so robust and it has something for everyone and at no cost. So definitely check it out.
Yes.
You might consider taking a class, maybe considering being trained. So there's a lot of something for everyone there. So Melissa, I want to thank you for being here today. And I also want to thank my colleague, Katie Kowalski from Beth Israel Deaconess Medical Center for helping me kick off this program this year with our Caring Collaborative Falls Prevention Workshop.
Thank you so much for having me, Debbie.
Thank you, everybody. And thank you, Quincy Public Library, for continuing to partner up with me to help prevent falls. Bye-bye.